Okay, folks, part D, which is not really directly health and medicine. It describes what's happening to the world because of the sad coronavirus, which is giving us so much trouble. So it says the impact of the coronavirus, and we're going to do it across many different areas. Okay. All right, just recently there was a large stimulus bill, a mere $2 trillion, and it has some direct impact on digital health. So this is one of the few slides which is directly digital health, and it points out there's going to be hospital funding because a lot of the hospitals obviously have a lot of additional expenses. There will interestingly be substantial funds to do telehealth. You remember this organization, I got this from the Business Insider Intelligence, didn't think telehealth would take over. But now there is some better chance, and this funds could help. And more broadly, the fact that there is some obvious advantage to telehealth, which have been highlighted by the social distancing and serious risk to healthcare providers from the virus. All right, here is a little more on telehealth. Points out that rural hospitals, which are the ones that telehealth is trying to help, have actually not done very well recently, and there's going to be money to help that. And of course, there's the virtual care providers, which is the telehealth directly. And here is some comment about, actually as a function of almost all ages, the majority of people say they're willing to try telehealth. And among the younger generation is dominant, 74% are very or somewhat willing. So that's likely to, well, here it gives an example, 312% increase in New York, which is obviously at the moment the most seriously impacted increase in telehealth services. And of course, this, as always, this increase in demand has led to a decrease in service from 6 minutes to 33 minutes wait time. Still, that's still quicker than going to the nearest hospital. Now we have a slightly different impact on digital health, is what will the recession do? Because obviously there is or will be a recession. And there will, for relatively obvious reasons, be some difficulties for initiatives which are not directly relevant to patients at this time. And in general, there's probably not necessarily likely to be a decrease in money going into healthcare. However, that money will go in digital health. That money will go into startups that are more clearly aligned with the problems that the coronavirus has highlighted. So that's what she says. They'll be more cautious. And again, telehealth, virtual consultations will be magnets. More generally, here is a survey as to whether there will be a recession, and most people think there will be a recession, and some people think there is a recession already. And people seem quite optimistic, but maybe that's life. People are optimistic. They do not think it will be, the majority think it will be moderate. Probably nobody really knows what moderate means. So the smaller firms will have difficulties getting money in these times. There are the availability of funding to do innovative things will obviously go down because you're going to put that money to absolute essentials. And the newer startups in telehealth or other digital health areas will have some trouble. And this points out, obviously, this increase in use gives you crashes. Zoom has had a sort of interesting problem. It's gotten violently attacked about security, although its scaling has been incredible. I've been on giant Zooms which appear to work perfectly. So you obviously diagnostic coronavirus testing going to be a hot product. And people who sell, I don't know, we had a comment about beauty. People that sell non-essential products, which are some of those software add-ons of digital therapeutics, they may take a blow because those will not be people frustrated and losing money due to the lockdowns are not going to go into discretionary spending. So, and especially when those people are selling directly to consumers, because the lack of money is directly true for consumers. Hospitals presumably have a better chance of keeping their money. All right, here is a sort of general list I found of some impacts on particular companies. So here is obviously a vacation or trip-related company. It's making major cutbacks. So something called Wonder School has laid off 75% of its staff. Airbnb is obviously significantly impacted, and one of their associates is laying off 30% of its staff. Real estate is certainly not a very hot business at the moment. It's having cutbacks. A company called Convene also cut off more than half its employees. Notel, which does flexible space, just laid off 30% of its workers and furloughed another 20%. AMC Entertainment, they in Bloomington run the local cinemas, and it said it's essentially cutting back and furloughing people so they can afford to reopen. Arbiladi, also in College Mall, is laying off people. Tesla is furloughing workers in some areas. Scooters, we have Bird scooters in Bloomington, though that is hardly a hot area now. People aren't scooting around quite as much as they used to. And many other companies, including oil giants, are having little problems. The oil is just not, people aren't traveling as much. All right, so here is a more general discussion of the virus and digital health, which repeats some of the previous remarks. This is about telehealth. It mentions a company called PlushCare, which has a 40% increase in appointment volume, and this particular company has a 10% increase during any flu season. And so anyway, this particular Business Insider expects telehealth to actually be successful. Remote monitoring. And it's clear that ought to be more remote monitoring. The current assembly of devices is very ad hoc. Some are on Apple Watches, some are not. Fitbit hides the information they get from you. It's really very unsatisfactory. So I think a much more thorough approach to remote health monitoring, where they actually make the data available, not only to doctors but also patients, is important. And we know remote monitoring is an important part of any telehealth. I once had this famous photo of myself in 1994 with Hillary Clinton, who lost the last election. At that time, she was trying to have a major health initiative in the US government, including telehealth, and I was showing her a demonstration back in 1994 of telehealth. So telehealth has been an area being researched for many, many years, but it has never taken off. We were doing it in things like prisons and other sort of special circumstances, but we effectively, after Hillary's effort collapsed, we stopped working in that area. Though others more diligent than me or more committed kept on. Here we have an alert system getting the latest updates. This is part the information retrieval. Remember, there was a company that actually claims to have identified the virus before the CDC, because they got it on December 31st, and the WHO and CDC were a week or so later. So there are companies which are providing this information and trying to extract from there's such a huge amount of real and fake information out there. They're trying to extract real information and get it to the people who need it is a pretty reasonable business. Banking. So here we're now looking at the virus on other of the areas we've studied. And banking was one of them, and lending is not going to be as good a business as it used to be, partly because the interest rates have dropped, and also there are going to be people who just can't pay their loans, and so the amount of paid interest will go down. And here we have increased credit lines and deferred payments, and these big banks are under huge pressure to be nice to people. And of course, people aren't going to put so much money in the banks because they don't have as much money. They're going to take the money out to spend. And then there's lots of social pressure for banks to be kind, waive fees, not crack down on people who are late on mortgage payments and things like that. And not pay overdraft fees and things like that. And notice there's $11 billion U.S. consumers paid in bounce check and overdraft fees in 2017. That's a lot of money in 1 year, just for which the banks would be under a lot of pressure to not charge. Workforce. Well, of course, I don't think many people will be going to banks. I know certainly it's an essential business. So there's going to be an increase in the digital banking. We actually discussed that in banking, so this will actually enhance digital banking. It seems Chase closed 20% of its nationwide branches. BBVA, which is, I think, a South American bank, are cutting back. And then there is a need for childcare for hourly employees because there's no school and things like that. Reputation. Actually, this is true for all these giant companies. You do not want to come out of this virus with a bad reputation of being cruel to people. And so this is important. Fintech. Well, here's another survey about recession, and here we have extremely and very likely 78%. So that says there'll be a recession, and here, in this one here, 38% says it will be severe. So that's quite a lot. And in the fintech area, there will obviously just be a reduction of funding, because I don't think fintech is one of these ones which in some sense will, unlike say medical device manufacturers, which will benefit from the virus because their products will be have enhanced value because of the virus. I don't think that's true of fintech. And we know that, remember how with fintechs work, they're all losing money to try to, well, a lot of them are. Some, if they're just doing, say, banking as a service, are probably making money if they, at least they could. The ones that are trying to get lots of deposits because they're neobanks, those will have trouble because they were losing money. And in this type of environment, losing money is less satisfactory than in a very optimistic bull market where everybody is doing well. So there will be less money to start fintechs and less money to rescue fintechs. And of course, that's what I was saying. It says companies will go bust. The smaller, less over-leveraged ones, which were maybe too optimistic, will not make it. Investors will be risk-averse, and there's just not money. There's just not the time to go out and say, "Hi, fellows, let's be. I can give you better stock advice." Nobody wants stock advice. They just regret buying stocks in the first place if they've all gone down 25%. If the fintech has made it through that initial stage and actually is flourishing, building banking as a service, then that will have a flip side, because banking as a service, which ought to go up, because this particular shutdown has actually enhanced the digital versions of all industries, not just health, but banking and everything. And we note here that the fintech actually got, the fintechs started booming in 2012 to 2014 through 2017 and 18, and they never have seen a financial crisis before. So the whole business model and mentality is geared to the bull. Is this a bull? I doubt it, no. It's a fox. So, some things will be interesting. Whether robo-advisors will actually have been trained to give the right answers for this particular example is not so obvious. I'm not certain humans were, but some humans will. So, it's a really tricky time. I wouldn't want to be a fintech at this time, unless I was building solid back-end banking as a service technology. And it says here, of course, they should really focus on sustainability, not growth, and exploiting current customers. So there will be some changes here, and it will just accelerate the shakeout between the winners and the losers. There are various new business models like income promise, which is basically some sort of product to insure people against loss of income, and whether or not this will be a good idea is not quite so obvious to me. I don't quite see how you make money on this, because there are going to be too many people who have to be paid, and not enough people who are willing to, because it's relatively obvious who will be laid off, so I'm not certain why that's a good idea. Here's an interesting comment on the gig economy workers on what their feature is, and this one here, either agree, strongly agree, or neither agree or disagree. So only 28% disagree with the statement that the gig economy, which is where we are now, I guess, they prefer flexibility and independence over job security and benefits. But of course, that will change as they need benefits. So these gig economy, as in the previous discussion, they have not seen a recession before. E-commerce will grow, but there will be a recession because non-e-commerce will go down more than e-commerce will grow. Because the consumer will, in net, spend less because they have less money. So that's sort of inevitable. And we know that brick and mortar spending will plummet because brick and mortar stores are closed, lots of them. Go to College Mall, full of closed stores. So this is one of these typical surveys which asks the obvious. Advertising is interesting. It wasn't quite so obvious, but advertising is going to really be hit. I saw an article that Pinterest, or whatever it is, the visual-based company, saving images and things, it has seen a drastic reduction in advertising. Here, Twitter has lowered its revenue forecast. And New York Times had, I think, a similar statement. So it is, whether there's a recession or not, there will be more digital advertising. There's not much point in physical advertising if people aren't going to physical places. But it's going to, even digital advertising will go down. For instance, there's no, if there is no Olympics. Well, there's a huge loss of money from the Olympics. Here is an interesting comment that advertisers are blacklisting virus-related news items. So companies like New York Times, in fact, most digital web enterprises have a strong emphasis on virus news. Well, advertisers don't want to be associated with viruses. They want to be associated with happy events. So so support news about the virus is a double whammy. New York Times is giving it away free, for example, whereas they usually have to pay for their digital, at least some of their digital material. But all the virus material is free, and it's not getting as much ad revenue. Here, New York Times believes that it will see a total of 10% decline in its ad revenue due to this issue. So these are all these are slightly more non-obvious consequences. And the claim is that the net effect will be at least as much as it was in the 2008 recession, which was almost 20% reduction. And here we are. We're up here in 2018 with a good solid increase, and it's probably went up again in 2019. But it's going to go. Well, who knows it will go? That's too optimistic. We'll go here, and we won't tell you what the scale is. All right. Don't ask me when this will be over. It's amusing that, well, not for podcast vendor, it's not amusing, but it's interesting that podcast listening has gone down because podcasts were listened to in cars, and people aren't using cars to commute to work nearly as much. So commuting has gone down, and therefore things you do while commuting, such as listening to audible music or audible recordings or podcasts, they've gone down. Here is a comment on the impact on our. You might have thought that companies like Google and Facebook were actually not impacted much by the virus, because most of their workers can write deep learning code from home as well as from their office, and further, there are going to be more people accessing their pages. However, they get all their money from ads, not from the services they offer. So their services are free, and they're going to get more people using them. Wonderful. However, the advertisers will not give them as much money. So they're going to be, here's an example, poor old Delta, I think it's the leading US airline. It hadn't done any ads since March 5th, after March 5th. And sports betting company, March 9th. Okay. The internet. Well, I was worried, I must admit, in the first few days I was home, that the internet would go down. Now, the internet has gone down, but it's actually so far come up relatively soon. In fact, even as I'm recording this, there was a storm, and the electrical supply in our house went off about 6 times, but rather surprisingly, it came back in a few minutes. Of course, now it will all go off for a week or something. But anyway, it is worrisome. We are in more and more are dependent on networks, whether that be networks be the internet, that's the most obvious, or even electrical. Because previously, if the power was off in our house, I could go and sit in the university, but now that's forbidden. Notice that one reason this is maybe better than you might have thought, both Netflix and YouTube lowered the video resolution to reduce the network use. And also the Federal Communication Commission gave access to additional spectrum to the cell phone companies. So the data loads of video game has gone up 75%, VPN 34%, web traffic 20%, and video 12%. It's interesting that video games are the one that's gone up the most. Maybe that's just because of the fact that school was cancelled. But you would think that, I don't know, I would expect, say, video and to be equally popular. But maybe I'm obviously not part of it. Cloud gaming, which is off to actually a rocky start, I think, it should actually, if the people doing cloud gaming get their act together, it should benefit from this. And according to British Telecom BT, they think their network can do even more than it's being asked to do now. And then we have the digital equality, or whatever it's called, namely equitable access to internet, is highlighted by these problems. Anyway, so here about connectivity. Well, obviously the connectivity has gone to the birds, initially in China, and now China's recovering. It's now in other parts of the world, especially, of course, New York City, France, UK, Spain, Italy, Germany, and this actually, unfortunately, that everything is connected. And now I think Apple can make its iPhone in China, but unfortunately can't sell it in the US, at least not so easily. Maybe you can sell it over the internet. Anyway, this will obviously reduce all commerce is going down, and iPhones will just be one of them, which will be impacted by people's money and also the ability to make it and ship it. So of course, it will be pretty interesting to see what happens to the relation of China and the world after this virus, because it's a slightly rocky relationship, and this could or could not make it better or worse. I think it depends. China's getting blamed a lot, but I think they've acted reasonably responsibly, and maybe that will get recognized, or maybe they will just get blamed for just screwing the rest of the world. Okay, lots of tech conferences, including ones I go to, are cancelled. And that has had huge impact. Of course, it must be somewhere else, but the whole travel industry has been devastated. Hotels, airlines, I mentioned Airbnb, and of course, with all these tech conferences cancelled, then people don't get to talk to each other and make so many innovations. So there's the direct loss of $1 billion just from cancellation of major tech events. And the online is actually a surprisingly successful replacement, but not quite the same. 5G is likely to get enhanced because 5G will make actually the interacting over the internet even better than it is now. And it will make telehealth and teleconferencing just better and better. And well, that's why we have here about ZTE and China Telecom building a 5G system, linking various hospitals together. So 5G has got a boost. How big an effect that is not quite clear yet. All right. Now we have some more remarks about 5G. This is just the impact of 5G on the world in billions of dollars, 127 billion in 2020, 209 billion in 2035. And we know we've already mentioned teleconferencing with Slack and Hangouts and Zoom, and 5G is just going to be actually a smoother way to go, because you can keep a 5G connection continuously, whereas if you start your wired connection in your office and you have to leave, well, your wired connection doesn't go with you. So a 5G connection is a more healthy way to go. Virtual reality is still trying to make it. Quite why this is again going to get enhanced, who knows? I'm very skeptical about virtual reality. It's too disruptive in the way you work. But here is a lot of listing of why extended reality is a good idea. It is, of course, more real, but the trouble is it's a reality that forces you to focus on your screen or your headset, and that's not obviously the way people work today, with a variety of inputs just dashing around and hitting you. So I'm not certain it's the right model. Of course, VR can obviously do enhanced things like trying on clothes, doing virtual labs for your university homework. That's probably one of the more interesting things. You could do a VR-based physics lab or engineering lab. Smart cities. Well, it's indirectly going to benefit because it's part of the digitally connected world, which is being enhanced by the events of the last few weeks. So here it says that here the people in China are using drones with thermal sensors to detect people with a temperature. If you ever go through China airports, you have to really show them you don't have a temperature. They're very they're correctly very cool. I mean, it's been proven good for them to be that cautious. And then, of course, there are various apps that automate a more clearer response to problems. Chatbots, obviously. So anyway, this is just pointing out that the pervasive deployment of technology, which is internet-based and digital and distributed, is going to get enhanced due to this virus. All right, how about ride-hailing? Well, it was just as I wrote this on March 30th, there was a sad story that Lyft wrote to their driver saying, please go and work for Amazon for delivering groceries and things like that. So, because Amazon is hiring and Lyft is obviously not hiring. And Uber is in slightly better shape maybe because they have Uber Eats, which up to now was losing money. But obviously, I've certainly personally used Uber Eats a lot more than I ever did in the past. And Lyft has said that over 100,000 of its drivers have signed up for these other opportunities. Well, how about payments? Well, cashless payments are going to continue to go up. And of course, not necessarily the ones at checkout stores, so more the ones through the internet. I show my card to my camera and automatically get charged. Obviously, generally retail will go down, and of course, when it comes up, it will inherit what the customers had learned to do, and they'd learned to use digital ways to pay after e-commerce. So even if they go off e-commerce, they may not go off e-payment. But of course, there's less money, and so MasterCard, Visa, PayPal will see less business. Here is coming from the United Kingdom that the use of money, cash is going down. That's sort of obvious. Cash is not so useful sitting at home. Because again, in the UK, it actually was later even than the US, but they have drastic stay-at-home measures at the moment. And it's probable that the cash will go down. Here is a current story that in February 2019, before the virus hit, even in those days, 69% preferred cards and only 28% cash. 1% checks. Well, we know the sad story of restaurants. They have to become online. So I'm now ordering a lot more food to restaurants, and not going to them, obviously. I was talking to people in China, and their restaurants are now open, see some of them, but they're socially distanced. So you're not going to get as many people in your restaurant as you used to. And that will probably stay for quite some time. I think socially distanced restaurants need to be thought through carefully, because that means you're probably going to have half or a third the number of people, even as your maximum capacity. That's pretty serious. This data here comes from OpenTable through Statista, which is this well-known source of statistics data. It likes to grab these gloomy statistics. Here is some data about. This one is from Statista, and this one from BBC, and it's about the number of flights. And here we have March, and a drastic reduction in the number of flights. And here is a sad picture of lots of planes. This one is British Airways, and here is an interesting picture of some of the passengers still flying. I actually haven't been to the airport since this thing started, and I don't know whether you see this type of effect at US airports. This one I took from BBC.com. So, extra protection. But actually, social distancing on aircraft is also a non-trivial problem, because, well, if you take these rules of several feet, that means your aircraft will probably be able to hold about a third the number of people it now does. Now, cruise lines are obviously in terrible shape, because there are all these terrible stories just continuing about cruise liners that have actually, not only they have the virus, nobody wants that cruise liner to dock anywhere near them. And so they're sitting out in no man's land, getting iller and iller. There's one near Uruguay from Alaska, I think, which is just not allowed to land. And here is a plot of the various disasters. Here is the general S&P 500 down 25 to 20%. Here is the airline stocks down 50%. Here's the cruise line stocks down 75%. Tough for that type of industry. And now we come to our last slide, which is food delivery, which we've sort of already implied. And there's sort of an interesting story here about insuring against getting the virus. It's in India, so this money here is not so much. And I say our favorite gig economy workers, who are the ones that are really taking to Airbnb and Lyft and Uber and things, and they're the ones that are going to get the hardest hit. And so, anyway, there's a whole new industry called insuring against getting the virus. So that's the end of this particular story, and we just went through a litany of many of the things that are changed by this virus. Okay, this is backdrop, and we're In the later lessons, we'll go on how to try to solve the virus. Thank you very much.